I would love to hear your opinion on prostate artery embolization, the PAE procedure. My husband, we've heard about that, and it sounds like a pretty amazing thing.
All right, so prostate artery embolization is, or referred to as PAE, is a procedure performed not by a urologist, by a radiologist, where they intentionally close some of the arteries that feed the prostate, so that now the prostate reduces in size, with the intention of then they'll have lesser urinary symptoms. Okay. PAE seems to be a fine approach for people with a very, very big prostate. I'm talking about 100 grams or bigger. I'm not sure that it's necessary for a man with a smaller prostate, though it can work. It's still relatively new, though the research is pretty good, showing that it is efficacious. The question that needs to be asked is his urinary symptoms related to his prostate, or is it not? And only the urologist will be able to tell. But if he does have a very weak stream that is constantly weak throughout the day, it might be that his prostate is contributing to the urinary symptoms. Because if it's not the prostate, then let's not reconsider any of these. And you know, just the natural approaches that work very well, and natural protocols, much of which I presented today. So I'd have no problems with PAE in terms of, I've recommended it to some people, but it's not a walk in the park. And yes, it's a fine approach for the right person if they take that approach, for sure.
Thank you so much. Appreciate that.
You're welcome. Sure.
Thank you indeed. And up next we have David A. Welcome, David.
Hi, how you doing? My main question has to do with exercise, and I subscribe to your email, so this is why I'm asking this question. You recommend doing 4 to 6 hours of exercise a week. Well, I could say the way some people would interpret that is do it all in one day. I believe your philosophy is to spread it out. And in fact, I think even during one day, let's say if you have an hour to exercise, I'm curious to know if you should do it in 15-minute segments throughout the day rather than just do 1 hour straight, because I think you said the body should continue to move as much as possible rather than doing all that exercise in one time. And then my second concern is you recommended fish oil. I'm wondering if algae oil is also okay, and also if you're concerned about it being rancid. And then finally, just a comment, I think one of the risk factors that I don't think you mentioned concerning whether it's prostate cancer or breast cancer are plastics.
Yeah.
Thank you.
Great. Thanks, David. So exercise, it reminds me of this notion of that men can drink up to 2 drinks a day, right? And they're fine, right? Women, maybe 1 drink or less to stay well. And oftentimes patients would ask me, well, if I don't drink Monday through Friday, can I have, 10 drinks on Saturday night? And that's the same thing, right? It's the same. So yeah, I guess there could be more clarity there. I recommend 4 to 6 hours a week of exercise, scattered throughout the week, whether it's an hour a day for 6 days, or an hour a day for 4 or 5 days, then 30 minutes the other 2 days, however way you can break that down. I recommend exercise typically at 7 days a week for people. And some people look at me like I'm crazy because how can that be good for you? But I do recommend movement and exercise 7 days a week, even if it's 15 minutes. Why? A, because we're creatures of habit. And so then if you know you're going to exercise every day, you always will do it. B, because there's psychological benefit to physical exercise. So the psychological benefit of exercise to me is even as intriguing as the physiological benefits. And thirdly, because there's also physiological benefits there where you can get your 6 hours in. Okay, so I do recommend 7 days a week. And then you mix it up. So do I recommend strength training or weight training all the time? No, but I do recommend it at least 3 times a week, for example. Okay, and I hope that helps, and combined with aerobic exercise and then other things that some people enjoy, like playing tennis or things like that, that counts as well, of course. Plastics. So xenoestrogens are a problem, and it's part of the reason why men, as they age, they have higher estrogen levels. So there's 2 reasons why men, as they age, have more estrogens in their body. One is because they get fatter, and the fatter you get, the more aromatization happens, which converts testosterone to estrogen. Okay, so that's why you want to stay lean, and BMI is not enough. And just because you're slim doesn't mean you don't have a lot of fat. People are walking around that are slim fat. Okay, so their body fat percentage, though they look slim, is still 30%, 35%. All right, they aromatize as well and then create more estrogen. And the other reason is because of these xenoestrogens and plastics that we are exposed to, that we should stay away from. We should be using metal containers and things of the sort. And the second question, I can't remember.
It had to do with algae oil and fish oil and the rancidity. And can algae oil be used instead of fish oil? And are you concerned about it being rancid for both?
Right. I use really good companies that I work with, and I think the really good companies do a good job on trying to minimize the rancidity of these oils. So it depends on the quality manufacturing practices of the companies that you use. So rancidity is always a concern and an issue, but for the good companies that are out there that make these, I have no concerns for both algae or fish oil. And I think algae works just fine. Yeah, algae, which contains the omega-3s, so the EPA, DHA, and my understanding that's where fish get it from. So you're getting it right from the source. So I think that's a fine approach as well. Flaxseed oil is not. It's not that because your body has to convert that to omega-3s and EPA and DHA, and then the body may not be able to. But algae is fine, and I have minimal concerns with rancidity with the companies that are that I work with and that are out there, and even some of the over-the-counter companies. They do a good job. All right, next.
Thank you, Doctor. And up next we have, Stephen V.
Thank you, Doctor, for a very good presentation.
You're welcome.
I know I'm 68, 67. I have an enlarged prostate, but it's not 100 grams, it's 40 grams. I'm on an alpha blocker, and that seems to help a little bit. And I've tried a high quality saw palmetto product, it was extracted with supercritical carbon dioxide. I tried it for a year. I didn't seem to see much difference.
Yep.
I don't know. How do you think about that?
Well, first of all, your prostate is not enlarged if you're 67 and it's 40 grams. So you don't have an enlarged prostate. The second thing is that I don't know if you have urinary symptoms. I think most men in their 60s will have some. So it depends what your baseline is before you started taking your saw palmetto. If in your baseline you had frequent urinary problems and getting up 5-6 times a night, then that nothing happened after the saw palmetto, then it didn't work. The alpha blocker for urinary, so the alpha blocker doesn't shrink your prostate. The alpha blocker helps with urinary symptoms, and it does a very good job in doing so. 2 side effects that come with alpha blockers. One is 3. One is retrograde ejaculation, where you don't see your semen when you ejaculate. The other is in some people that have a history of sinusitis, then that intensifies, the sinusitis intensifies. And then the third is related to blood pressure. It can actually lower your blood pressure a little bit too much. So what I would say is that that I'm not sure that saw palmetto is working for you. I would say the alpha blocker is probably working for you. I don't know. and I would use the botanicals that I posted up on this presentation, which includes curcumin, quercetin, boswellia, and all those. I think those work better, and a prostate support formula that contains those probably works best. I'll be writing a lot about those things for those. I think it's on Q as it relates to BPH, and it's probably on a podcast coming up soon as well. So I'll have more details, but that's a good starting point for you, Steve.